Hi, very good evening. So first of all, it's a new setup, so I had to take a lot of time to arrange all these things. So I have been checking all of this for a while, because the moment I place it in a video format, it's completely different from a live format. The moment I made this video live, the entire setup was again different. So I had to take some time to arrange all the things. I hope it is clear. I hope the path is clear, and I hope my voice is also clear. If you want me to raise my voice or if you have any issues with streaming, do let me know now itself. Right? A very good evening, all of you. Hi, a very good evening. Fine, so we'll proceed then. So today's live session will focus on few multiple choice questions which I have created from the topic periapical pathology from endodontics. Also, we'll have few image-based discussions, right? Not as such image-based questions, but we'll have image-based discussions as well. I hope you guys are ready. And once we conclude this session, it's around 9 p.m. exactly, right? So by 10:30 p.m. Indian Standard Time, we'll have our study club discussions as per the schedule. Fine? I hope you guys are ready. So we'll start with our first question. Voice is early? You mean to say there is no sync? If that's the case, try refreshing your page, try refreshing your web page, or try reopening the YouTube app again. There will be a sync. If everything is fine, just give me a thumbs up, we'll proceed with our discussion. Right? Okay. I'm taking Akila's words into consideration. She says everything is, yes, it's clear. Okay, fine. So we'll proceed now. So first and foremost, you might have heard of Fish Jones or fish concept, right? The name of the scientist, fish, not the eatery fish. So based on that, I framed this question. Arrange the following zones inside out based on fish experiment. Zone of irritation, zone of contamination, zone of infection, zone of stimulation. So which is present? Which of the following zones is present in the center, and which of the following is present on the periphery? So as you know, we have fish zones. Whenever there is any infection, periapical infection, or based on fish experiments, we have certain zones. You might have heard of it, isn't it? Yeah. So what fish has tried to do is he tried to disprove focal infection theory. So focal infection theory, according to focal infection theory, teeth are bags of infection which had to be eliminated. There were countless extractions in the past, right? So to disprove focal infection theory, he has come up with this experiment where he has inoculated the culture, Staph aureus culture, onto cotton rolls, and he has implanted them into mandibles or jaws of guinea pigs, and then he sacrificed them after 4 to 40 days, and then evaluated the lesions periapically. And what he has found is quite interesting, which disproves focal infection theory. Because according to fish experiment, most of the infection is confined by zone of infection by polymorphoneutrophils. So neutrophils are confining the bacteria without allowing the spread of bacteria. And for your information, focal infection theory is nothing but, according to that, any localized infection is responsible for generalized weakness or generalized diseases. That's focal infection theory. That theory suggests that any infection which is localized spreads throughout the body and causes all these unnecessary abnormal things. But fish experiments have proved that bacteria as such do not get decimated. Based on his experiments, he has proved that bacteria are limited by neutrophils within the first zone, which is nothing but zone of infection. So as you are rightly mentioning, the innermost zone is zone of infection. As you can see in this image, if you want I can zoom in, do let me know. So the innermost will be zone of necrosis or zone of infection, which contains bacteria as well as neutrophils. And this zone of infection is surrounded by zone of contamination. This zone of contamination contains clear round cells. And this zone of contamination is surrounded by zone of irritation, which contains histiocytes and osteoclasts. And finally, on the periphery, you have zone of stimulation, which contains various fibroblasts, capillary or neovascularization, capillary buds, and most importantly, we also find osteoblasts. So these components of various zones are also very important, right? So this is of historical importance, and there are many studies in continuity with this fish experiment. So this is a summary, and these are the arrangements from inside out. Hope you had made it out, right? Exactly. Okay, so before I proceed to the next question, do you want me to raise my voice, or is this fine? Is this bass voice fine? So arrange the following zones inside out based on fish experiment. So if at all such a question is asked, so the first or the innermost zone will be zone of infection, followed by zone of contamination, followed by zone of irritation, last or the periphery is zone of stimulation, right? Okay, some wants me to rise and some says it's fine. Anyways, it's better if I raise my voice, right? Okay. Second question. Periapical lesions are sterile, infected. Which option would you choose? You know, we have several periapical lesions, right? We have acute apical periodontitis, chronic apical periodontitis, or periapical granulomas, chronic osteomyelitis, right? Foreign body reactions, condensing osteitis. So any periapical lesion, or I forgot the most important one, acute apical abscess, chronic apical abscess, phoenix abscess. So all these periapical lesions, do you find them to be bacteria free or are they infected? That's the question. Sterile. So almost 50% of you are saying it's sterile. The rest are taking the option infected. Okay, Kunal says granuloma is sterile. Hina says infected. Okay, if you refer Cohen, it's clearly mentioned that previously it was thought that granulomas especially are sterile, but later studies have proved that most of the periapical lesions are infected. They contain bacteria. On culturing, on histological examinations, they could demonstrate bacteria. So the conclusion is, yes, periapical lesions are infected. Even though they were thought to be sterile previously, they are infected. And for this very same reason, it is mentioned clearly in Cohen saying that non-surgical endodontic treatment is alone not sufficient. So even though if you perform a very good root canal treatment, right, if there is periapical lesion, obviously it contains bacteria, as we discussed now, it's infected. So these bacteria can be a potential source of infection again. So non-surgical endodontic treatment is always not sufficient. Sometimes endodontic surgery has to be performed depending upon the symptoms, depending upon the size of the lesion, and so on and so forth, right? So that's one of the related points which is given. So particular to this question, periapical lesions are infected is more appropriate answer, right? I hope it's clear. Okay, perfect. Now let's move on to the next question, and before that I have some radiographic images. See, you can see periapical lesions, you can see periapical radiolucence, a well treated or supposedly well treated root canal treated tooth. You can see good obturation over there. However, there seems to be periapical lesion. See, the radiolucency which you see in the periapical region can be a healing lesion or it can be an infected one. So how do you decide whether it's healing or whether it's infected? It depends on the symptoms, isn't it? Right? So as per the information given, non-surgical endodontic treatment alone may not be sufficient, right? Because the objective is to eliminate infection. What is the source of this infection? Bacteria. So when bacteria are present periapically, sometimes you need to address periapical areas as well, right? Through endodontic surgeries, microsurgeries, or whatever. Fine. So Anika says periapical lesions are sterile if periodontitis is due to blow, trauma, or chemical. Okay. Fine. Okay, let's move on to the next question. It's related to general path as well as endodontics. So it's a combination of basic and clinical subject. Let's see how many of you are going to answer this right. During phagocytosis, breakdown or degradation of bacteria or antigen occurs by lysosomal hydrolytic enzymes, acid pH in vacuole, lactoferrin, hydrogen peroxide. So which of the following would be more appropriate answer? During phagocytosis, breakdown or degranulation of bacteria or antigens occurs by lysosomal hydrolytic enzymes, acid pH in vacuole, lactoferrin, hydrogen peroxide. Remember, as you know, phagocytosis is performed by neutrophils as well as macrophages. So for phagocytosis to occur, we have something called as opsonization. Opsonization is nothing but a process which enhances phagocytosis. You have IgG, IgM, C3b, which are opsonins, which bind to antigen or bacteria and make them susceptible to phagocytosis, right? So these neutrophils or macrophages engulf these opsonin coated antigens or bacteria and form something called as phagosome. This phagosome binds with the lysosomal contents and they form phagolysosome. On combination, there is breakdown of lysosomal products or release of lysosomal products, and there is ultimate destruction or nullification of antigen or bacteria. So which of the following options would be more appropriate pertaining to this question? Yes, Mubashira. Okay, I'm sorry, but all of you have landed nicely in soup. 2 bowls of soup. So it's not just option A, it's all of them. All the 4 mentioned are means through which there is nullification or destruction of antigen or foreign body or bacteria. Right? So lysosomal hydrolytic enzymes, acid pH in vacuole, lactoferrin, hydrogen peroxide, superoxides as well, right? We still even have some list. So all these are means through which there is breakdown or degradation of bacteria or antigens, right? So just make a note of it and keep this in mind. I hope it's clear. So shall we proceed to the next one? So this is an electron micrograph of a large macrophage with a full phagosome. Let me just zoom in so that you can just visualize it clearly. So you can see this is a macrophage. It's a macrophage and you can see various neutrophils, right? So this is a very huge cell which is nothing but a phagosome which contains the opsonin coated antigen or foreign material within, right? So it's an electron micrograph or electron microscopic image of a large macrophage with full phagosome. When you have visualization of these pictures, then subject will be much more fun and interesting, isn't it? Okay, it's a black and white image, so it's not so clear, but at least you can visualize the outline, right? Okay. Now let's move on to the next one. 4th one. The diagnosis of acute inflammation is clinical only, histologic only, both, none. So which of the following would be more appropriate? How do you make a diagnosis of acute inflammation? As you know, inflammation is nothing but a localized response of a vascularized living tissue to some kind of noxious stimuli. And we have classical signs of inflammation as you're all aware with: rubor, callus, tumor, dolor, and functional issues. So acute inflammation diagnosis is in terms of periapical lesions. We're talking about periapical lesions, right? We'll not generalize it. Periapical lesions. Is it clinical only, histologic only, or is it both? Okay. I see majority of you choosing both, but few of you choosing histologic. Both is smart answer, both is right answer, right? See, histologic examination is considered as gold standard, there is no doubt in it. But do you go for histologic examination when a patient comes with acute apical periodontitis or acute abscess? We do it based on clinical signs and symptoms, isn't it? So the diagnosis of acute inflammation is by both clinical as well as histologic. It's not just clinical or it's not just based on histologic examination. I hope it's clear. So both is right answer. Well done. Now let's move to the next question. All of the following are acute conditions except acute apical periodontitis, acute apical abscess, phoenix abscess, acute osteomyelitis. So which of the following is not an acute condition? Yes, Kunal, we'll discuss that. How do you know whether it's acute or chronic? It's based on the nature of cells which are present histologically. It's based on the kind of symptoms which patient exhibits at the time of presentation to our clinic, right? So we have various criteria based on which we differentiate acute and chronic. Yes, all of the following are acute conditions except. So which one would you choose? All of the following are acute except. So you need to choose the chronic one, right? So which one would you choose? Kiran is smart. She got used to my questioning pattern. See, mere giving you options doesn't mean you'll find an answer there. All you need to get to know is the right answer, not to choose one of the options. If that's the case, I'll make you people land in soup. I'm just kidding, okay? So it's none of the above. All of the following are acute conditions. Acute osteomyelitis. Yes, we have acute osteomyelitis. Yes, acute apical periodontitis, acute abscess are obviously acute. But what about phoenix abscess? Phoenix abscess is nothing but an acute exacerbation of a chronic abscess, isn't it? So all of the following are acute. So except, so it's none of the above. Fine? Okay. Perfect. Well tried, but well tried. We can see a case, you can see a clinical picture. I'll just zoom in. Can you make out what kind of swelling is present? You can see some kind of swelling over here. So what kind of swelling is that? Which spaces are involved? If that's the question, what would you answer? Which spaces are involved? You can see the nasolabial fold. A nasolabial fold is obliterated, so canine space is involved, and and buccal space as well. Wonderful. So obliteration of nasolabial fold gives you a clue that it's canine space as well. So it's canine space as well as buccal space. You can compare with the contralateral or the opposite side. So you can see on drainage how much amount of pus is being collected. It's a case of acute apical abscess, right? I don't think the picture is very clear. Yeah, canine as well as buccal. So you can see a lot of matter being collected in a kidney tray. So it's a case of acute apical abscess. Pus and blood drain externally into a basin from the incised abscess. Another case where you can see dental caries in relation to maxillary right central incisor. So there is even pulpal involvement with periapical lesion, and patient presents with the following symptoms or signs. There is cellulitis of lip and also canine space involved because of this particular tooth, right? So this shows the severity of the periapical lesions if left untreated, right? Yeah, I'm really sorry. It's a black and white image. It's a dental caries. It's nothing but dental caries. Even here, even in my tab, it's not so clear. It's a black and white image. It's a normal dental caries. It seems to be like dental caries, but it is involving periapically with periapical lesions. At least the clinical picture is clear, right? So you can make out from that. Yeah. I'm trying to zoom, right? So this is a zoom which I can achieve. Maximum. See, here the clinical picture is important, right? Because intraoral images are not so clear. You can neglect them, fine? Okay, now let's move to the next one. So before that, again, we have another image. Can you make out a diagnosis? I'll give you certain hint or clue pertaining to these images. Let me know which is a more appropriate diagnosis. I'll just zoom in. If it is not clear, I'll try to project my tab. Okay, so all you need to do is focus on this particular radiograph. You can see it's a IOP of mandibular anterior teeth. periapically there is a huge lesion. Patient complains of severe pain, and the moment access opening is performed on central incisors, lot of pus is coming out. Lot of pus is coming out. So periapically you can see a huge lesion, and on clinical examination, on performing access cavity preparation, there is exudation of pus. So what could be your diagnosis? And patient complains of symptoms, patient complains of pain, swelling and whatnot. So what could be the tentative or provisional diagnosis? No, Divya, in previous slide submandibular is not involved, it's only showing the swelling pertaining to lip. Endoperial lesion? Okay. That's my question. As one of you said, it's an acute apical abscess. That's the reason why I have posted this image. Acute apical abscess, you will not find periapical changes. You will not find so drastic and clear radiolucences. Because as one of my students was telling this morning with some reference, 35 to 50% of bone has to be lost so that the periapical lesion is visible on a radiograph, right? 55% or 60% or 35%, so different studies got different values. So it can't be an acute apical abscess, because in acute apical abscess cases you will not find so much of appreciable periapical changes. Only in case of chronic abscess you find these cases, right? So what could be the diagnosis? Patient has acute symptoms, but radiograph reveals chronic kind of lesion. So I've given you the answer. Exactly. As Supreet rightly mentioned, it's nothing but phoenix abscess. So phoenix abscess is acute exacerbation of chronic lesion. So it's a chronic lesion. Patient complains of acute symptoms and also there is pus discharge, right? Okay, well tried. Now let's move on to the next one. We have two statements. Statement 1, acute inflammation is a proliferative response. Statement 2, chronic inflammation is an exudative response. So which of the following statements is true or false? Statement 1 states that acute inflammation is a proliferative response. Statement 2, chronic inflammation is an exudative response. Which of the following statements is true or false? I see majority of you going for option C. Both statements are false. Acute inflammation, it's more exudative in nature. You see pus formation, discharge of pus. Chronic inflammation, it's more of proliferative. Because of fibroblast stimulation or whatever, it's more of proliferative, chronic. Whereas acute is exudative. So both, it's ulta would be a right answer, right? So both the given statements are false. Acute inflammation is an exudative response and chronic inflammation is a proliferative response. As simple as that. Fine? Okay. Now let's move on to the next one. The purpose of immune system is to neutralize a stimulus, inactivate a stimulus, destroy a stimulus, none of the above. So which of the options would you choose and which of the options do you feel is more appropriate? The purpose or the function of immune system is neutralize a stimulus, inactivate a stimulus, destroy a stimulus, none of the above. Divya, Sunny seems to be having increased amount of smartness as we are moving towards the ending of the session. I think they got used to the questioning pattern. This guy will be giving these kind of questions, so it's now easy to answer, right? No, we'll make it more challenging from next time. It's all wonderful. It's all of the above. Purpose of immune system is to neutralize a stimulus or inactivate a stimulus or destroy a stimulus. It all means the same. It's nullifying the challenge, noxious stimuli, right? So A, B, C are right answers. Fine? Good, well tried. Now, eighth one, Granuloma refers to, this is a comparatively easy question, so you must be answering this very fast. Granuloma refers to acute apical periodontitis, chronic apical periodontitis, both, none. So which one would you choose? Now you can't say all, right? It can't be all every time. Exactly. So chronic apical periodontitis is also called as granuloma. As you know, the size of granuloma is less than 1.5 centimeters. Clear-cut, well-defined radiolucency. It's a chronic case, so it is asymptomatic. Remember, chronic apical periodontitis, it's asymptomatic. Fine. However, you'll find radiographic changes, as we have been discussing now. So option B is right answer. Now, a case-based question. Since you are saying it's not very clear, I'll just come closer and try to project my tab so that the images might probably be much clearer. Just have a look at this. I hope you can see. Just give me a few seconds. Yeah, I hope you have observed this, right? No reflection, right? I think we can proceed. Yeah, perfect. So you can see on the left side, mandibular first molar, there is deep dental caries and also seems to be pulpal involved, and radiograph periapical changes are quite evident, isn't it? So periapical changes are quite evident. On right side you can see GP placed, and it's nothing but gutta percha tracing. Gutta percha being placed inside the sinus and it's being traced. So what could be your probable diagnosis? Patient has no symptoms, right? Patient has no symptoms. You can see GP tracing, I'm just zooming in. So GP is placed and maybe radiograph was taken later, which we don't have now. So this GP tracing is done to know the point of origin, whether it's endodontic origin or periodontal origin, isn't it? Yes, it's definitely an endoperio lesion. So what could be your diagnosis? Yeah, I hope you have seen that clearly. Suppurative periodontitis or granuloma with fistulation. That's the diagnosis. That's the term which is given. Granuloma with fistulation or suppurative. You know the difference between sinus and fistula. Sinus is a blind opening. Fistula, you know there is epithelial lining. Studies have shown that most of these tracts do have epithelial lining, right? So it can be considered as fistulation. Fine. So it can be considered as a suppurative periodontitis or granuloma with fistulation. So that's the diagnosis given in Cohen. And also based on the history, based on the radiographic presentation and clinical pictures, the diagnosis is conclusive. Well tried. Wonderful. Now let's move on to the final question. A pretty simple one, but let's see how it goes. Periapical disease is caused by bacteria, bacterial products, host response to bacteria, all of the above. Last question of today's session. Periapical disease is caused by bacteria, bacterial products, host response to bacteria, all. Madhusha is the odd one out. Madhusha says host response to bacteria. Rest of you say option D, all. See, obviously bacteria and bacterial products release certain enzymes, toxins, and you know what, it's not just when you clap, they say when two hands meet we do make a sound. So it's not just one hand, it's the opposite hand which actually also plays an important and equal role. So it's not just the bacterial challenge but also the host response. So host responds through inflammation, and the most array of symptoms or signs which we see are mostly because of consequences of inflammation. Rubicular tumor, dollar, and functional lesion, right? So even host response is equally important and is also responsible for periapical disease. Even though it's considered as a defense mechanism, but in the process there is some destruction that's happening. That's the reason why we have something called as host modulation in periodontics, which is an important concept. Take for example periostat, which is 20 milligrams doxycycline. Why do you give that? So host modulation, right? So why do you give periostat? So periapical disease is caused by all of the above. Wonderful. Okay. So why do you give a periostat? I haven't received any answer yet. Okay, try answering. And before we conclude our routine, identify the place based on this iconic statue. Today one of my students was saying it's Statue of Liberty. I mean, she was sleepy till then. I think she woke up right at the moment of the image projection. So identify the place. Identify the statue. Exactly, Rukia. Madhusha, wonderful. To reduce or to have it's not to reduce. Okay. It's not to reduce anticollagenase activity, Madhusha. It's to promote anticollagenase activity or to reduce collagenase activity. So don't get confused. So periostat 20 milligrams, anticollagenase activity to prevent destruction of the fibers, periodontal fibers. To reduce, to reduce collagenase activity or to have anticollagenase effect. Preetu says it's Gujarat. Preetu, this is not Gujarat, by the way. It can't be Gujarat all over the world. I do agree that you are very excited with the new statue, 3,300 meters or whatever. Is it 300 meters? Okay. So this is Christ the Redeemer, Rio de Janeiro, Brazil. How beautiful the place is. Of course, even India is good, India is great. Gujarat is also very good. But look at this. Awesome. It's definitely not from Pakistan, right? Someone says Pakistan, Ankit says Pakistan. No, Ankit, it's not from Pakistan or Afghanistan, it's from Brazil. We have a country called Brazil in South America. You're obsessed with Pakistan and Afghanistan? Yeah. Statue of Unity? No, this is not Statue of Unity. You're talking about Gujarat? Yes. No comments on Gujarat statue, okay? Exactly, Madhusha. I think you got the point. Yes. Maybe it was a use of choice of wrong words. Yeah. Okay. So I hope you enjoyed today's session. So we'll definitely have, in fact, I've come to my native place and I should tell this on live. My mother has worked extra hard to make all these arrangements. So I'll thank her later, but I wanted to tell this in live as well. We worked for 1 hour. She worked for 1 hour arranging all this stuff, and if you really come here and see, it's all like haywire. So it's all clumsy, and somehow she managed to get all this stable. TV used to be on top, and we have, I forgot my tripod, by the way. So there are lot many suitcases, tables, on which you're watching me right now. So all credits to my mother today for making this arrangement possible. I thought I couldn't make any live session, but finally I could make it. I'm very happy for that. I hope you enjoyed today's session. I hope the objective of the live session has been fulfilled, and see you again in another live session tomorrow. We'll have definitely one live session per day, at least till Thursday, tomorrow and day after tomorrow. Friday and Saturday, I'll let you know again. Fine? So any queries, anytime, you can always drop a mail at proudtobedentist@gmail.com. Few more weeks, just maintain the momentum. All you need to do is just leave out speculation, negativity, and just focus on what you're doing right now, right at this moment. Just give your best. You will definitely receive the best. It's only few more weeks. It doesn't matter how it has been all this while. So it's all about how you orient yourself now, how you orient yourself right now, right at this moment. If you're positive, it's going to be positive. If you're cool, it's going to be wonderful. If you're cool, you're going to remember everything, take my word. And you can't question me saying, how can we maintain cool when you have an exam? It doesn't matter. It doesn't matter. Exam or no exam, it doesn't matter. Only if you maintain cool, you'll enjoy the process and you'll definitely do well. Please take my word. Fine. So wish you all the best. Love you all. See you again tomorrow in another live session. And we'll start that study club discussion by 10:30 after my dinner. Fine. We'll conclude that. Yeah, you're most welcome. I'll definitely show these comments to my mom. I'm sure she will be very happy. Thank you. Okay, bye.